Hi everyone, Patrick Menninga here, spiritualriver.com. I want to talk to you today about major depression and how that relates to addiction and alcoholism. Now, major depression is not a situational kind of depression. So if you ask someone what's wrong with you and they say, oh, I'm depressed, and you say, well, why are you depressed? That's not depression. If they can tell you why they're depressed, then that's situational. They might say, oh, my dog died, or my spouse passed away, or something like that. That's not major depression. That's situational. So when we're talking about major depression, we're talking about something that doesn't necessarily have a cause. And many times, if someone's depressed, they will self-medicate with drugs or alcohol. And what's important to know about that is if someone's depressed and they're also self-medicating, then we have two problems. We have the addiction and we have the depression. And in that case, we have to treat both of them at the same time. So that person needs to go to treatment. They need to call up a drug and alcohol treatment center, get into detox, go to residential treatment, start getting help for their addiction. And as they're doing that, when they get out of treatment, they need to immediately seek help for their depression and start treating that as well. We can't isolate these things and just work on one of them at a time and expect for the person to become healthy. And the reason for that is because depression leads back to addiction, and addiction can lead back to depression. So it doesn't make any sense to treat them separately. You have to treat them together. There's an element of holistic health when it comes to overcoming depression, and there's an element of holistic health in terms of overcoming addiction as well. So in other words, that once you're healthy and living a life of recovery, hopefully you'll be doing something for your emotional health, for your spiritual health, for your physical health, for all these different aspects of your life. And it's not realistic to say to someone who's depressed, who has major depression, you need to get out there and exercise. Well, that's not realistic. If they could do that, they would. And they can't. So in some ways, treatment for depression and treatment for addiction is about building a bridge to that life, to that ideal life, that does include exercise on a regular basis, that does include healthy sleep habits, that does include healthy nutrition and eating good healthy food. So getting to that place is not going to happen overnight. And that's what treatment is all about, and that's what recovery is all about, is you need to start somewhere. And for a lot of people, that's going to be inpatient treatment. Get on the phone, call a treatment center, and say, hey, I need help. Go to treatment and start getting the help you need, and then you can start making those lifestyle changes that will get you to a place where you're healthy, where you're physically fit, where you're eating properly, where you're getting good sleep. And that's how you're going to overcome alcoholism and drug addiction and depression in the long run.